This 24-year-old woman presents for rhinoplasty. You can appreciate the dorsal hump blending with the tip. On lateral view, you can see a deep nasofrontal recess with good projection and rotation. The submental view, the hump looks more obvious than the tip. In the zoomed in, you can see a broad, boxy tip with irregularities. Frontal view shows a C-shaped deformity with a light reflex, irregularities of the ala, especially on the right-hand side. This rotating image is useful to communicate with the patient and determine problems and goals. Here you can see that prominent dorsal hump and no supratip break. We use 3D analysis and planning using the rhinoplasty tool. Again, a C-shaped deformity, a prominent dorsal hump, deep nasal frontal recess. We can adjust the tip position, create a supratip break, bring down the dorsum, augment the radix area. Here too we're adjusting the ala. On frontal view we can narrow the tip. We can simulate placing a spreader graft to widen the mid-vault and address this C shape in irregular light reflex. Next we can look at the before and after simulated view, communicate this with the patient, and ensure that we're on the same page for goals. This is the rhinoplasty diagram showing the spreader grafts, septal extension graft, fat grafting. Here you see correction on frontal of the C-shaped deformity, better tip definition and a better equilateral triangle, better support at the alar base, gentle dorsal lines blending to the tip with a very subtle and gentle supratip break. On the lateral view again, good dorsal definition, smoothing to a supratip break. 3D image shows correction of that C-shaped deformity, smoothing of the dorsum, correction of the deep nasofrontal recess, better tip projection, definition, and a small supratip break.